Okay, good afternoon, everybody. We're going to go ahead and get started now. Thank you and welcome to today's webinar on best practices for successful EHR data conversion. My name is Monique Dever, and I'm going to be the moderator for today's webinar. Like I said earlier, we've got 1 hour blocked out for today's session, but the presentation won't require the entire hour. So we'll have plenty of time at the end for Q&A. We're going to go through some of the attendee participation kind of housekeeping. How come that's not in here? Sorry, we're having a little technical difficulty. There we go. Okay, so on your screen, if you're not familiar with the GoToWebinar process, on the right-hand side you'll see a kind of a communications box. We are going to have all the attendees in mute throughout the presentation so that there's no static on the line. So this presentation box is your way of letting us know if you have questions. You can submit those by typing them into the questions box. The little red arrow attached to that box will shrink and expand that dialog box so that you don't have to have it in your way. So like I said, at any time you have questions throughout the presentations, just log them there and we will answer all of them at the end of the presentation. Today's presenter is Don Sargent. Don has over 20 years of experience in the healthcare IT and medical software industries and is currently the Director of Customer Experience here at Patagonia Health, where he leads the account management and implementation teams. Don has already managed numerous migration processes for our new clients and is outlining here what he has compiled as proven best practices for a successful data migration process. So at this time, I'm going to turn the presentation over to Don, and he will get started.
Well, thanks, Monique, and good afternoon to everybody. And thanks for joining us today for this presentation, this best practices for successful data conversion or data migration. What we're going to go through today in our time is some of the best practices that we have uncovered in our time doing data migrations with our customers, a number of lessons learned along the way, and there's also several keys to success for data migration. So we'll hit on those. We have a process that we go through, and then we'll also review some of the data requirements at the end of the webinar as well. So let's get started. So let's start with what we know to be true with nearly all sort of data migration projects. That there are invariably always a number of key factors that emerge from each project. It's tied directly to the success of the project. It's just you don't usually know what they are until you begin the process. So we will review this process that we go through and go over a number of the places where we would typically find these types of key factors. So this is in fact a process that we do go through. So in moving data from a customer's existing system to Patagonia Health, how relatively simple or complex will depend again on some of those key factors that are discovered. Some of the, for instance, if we were looking at a project and we would ask those questions: how much data is available? Is there a limited number of data elements that are being considered to be migrated, or is there a large number of elements? Are the existing data stored in a structured and discrete manner or format? And when we look at structured data, we're looking at anything that would have been entered into a system using a drop-down pick list or a drop-down menu, a predefined data selection, versus free text data, which would be data that's just keyed in at the user's discretion. We also look at things like, does the database contain data that's been entered via some other data entry standard or policy for consistency? So are best practices for data entry standards being used? And so we run into this sometimes because we'll have users that will sort of, I enter it here and she enters it there, and we don't have a consistent landing place in the database for some data. So we run into that every once in a while. Also things like the database being populated potentially with data from a previous conversion. So you kind of get the idea. There are a number of factors that will come into play as we move through that process. Of course, collaboration is required and very important, between the customer and the Patagonia Health team. Oftentimes it requires assistance from an existing vendor to access data, or it's not unusual for like your local IT representative or a DBA if you're a larger organization to be included on the migration team as well. The bottom line is you understand your data better than anyone else, and so when it comes to making those decisions, we rely on the client. From a responsibility standpoint, this is not a project that you can hand off to your vendor, nor is it a project that we would willingly accept without your participation. And it's not a project that you can always just hand off to an IT rep at your site. It takes a team of people, particularly content people who understand the data. So it takes ownership from many levels, and with each person playing a role and being responsible for their own process steps and deliverables. And of course, last but not least, the data migration process will require customers to make many decisions or determinations regarding their current data. So how much of it's available to convert, how much should you really convert, the methods of how various data will be converted into Patagonia Health, and the overall priority regarding the data to be converted. So you get kind of the idea there. So the bottom line is that the overall data migration process can be complex. Okay, so to help reduce some of the complexity, we have a set of process steps that we follow for each project, and so you'll see those on the screen. The data migration process can break down into these 5 elements. We spend more time in some, less time in others, but ultimately it's these questions. Is there data available to discover? That's our discovery phase. Scoping, defining the scope is what data can we use of that data that we find. And then there's a conversion programming. How do we move that data? Then validating the data. Are there any errors to correct within the data conversion? And then ultimately the data migration. Did the data get migrated correctly and completely? So let's go through each of these steps one at a time. Okay, data discovery, the first step. Every project begins here with the discovery phase. This is the process of the customer reviewing the data from the current system. You got to see what data is available and eligible for potential data migration. So reviewing data entry processes and standards is sometimes useful in determining whether or not data will be complete or consistently entered by all users. So like I mentioned before, sometimes there's gaps in the data. Folks will use different fields to store similar data, and that gets discovered oftentimes during the data discovery process. So there are many limiting factors to be uncovered, but hopefully much usable data to be found. In this initial step, it can be one of the most challenging parts of the process overall. The bottom line here is the customer should really control the discovery process as they know the data best. The customer is ultimately responsible for extracting data from their current system and providing it to Patagonia Health. We'll give you some specific formats and some guidance. So scope definition, the second step. So now that you've found some data that's available, it becomes the process of understanding that data that you have and defining a scope for migration. So what are we going to do with the data that we've found? This can be as challenging as discovery. The other side, though, is if you don't find a lot of usable data, then you've got far fewer decisions to make. So it kind of goes both ways. Defining a method for data conversion can include a number of things. Data mapping is the first piece. This is a process of mapping a data element from an old system to a corresponding data element in a new system like Patagonia Health. So much of the mapping can be fairly straightforward, and that process can be fairly straightforward. An example might be a patient's first name, for example. We might call it patient first name in the old system, but it might just be referred to as first name in Patagonia Health. So we would map those elements one to the other. Or there can be a less obvious mapping where a field that captures some data like a patient's social security number in one system might actually migrate to a citizenship field in another system. So sometimes it's not as direct as it might look. Also, with each data element that is mapped, there may be a need to cross-reference the values within that element. So let's say like the race field is defined with a numeric value in one system, but the new system might use an alphabetic character. So an example might be Native American in your system is 01, but Native American in our system might be NA. So we would create a crosswalk that would say Native American, and we'd have two columns, one column for the old system, 01, and a column for the new system, NA. And now we've created a crosswalk for those values within that race element. And we would do that for each field that qualified. It's also important to consider, data migration strategy as well. If you're migrating patient demographics, then your strategy might just be to migrate, as much good data as possible. But you may also have 25 years of data and 800,000 patient records in your current system. So do you want all of those records? Do you really need all of those records? This is your choice. So there are methods for qualifying what records you might want to migrate. So for example, you might create a definition of an active patient first, and that might be a patient that has been seen with an encounter or a last visit date within, let's just say, the past 3 years, or something along those lines. If that data is available to make that qualifying condition, then this is possible too. So again, the customer is ultimately responsible for making final decisions regarding the data that's discovered and the data that's available to be migrated, and any related questions regarding those methods. And again, we're here to help you make those decisions. The third step is largely a Patagonia Health technical team step. This is developing the conversion program and some initial testing. So the Patagonia Health is responsible for the development of the conversion programs and any of the processes required for your project. We will also test the conversion data. We'll use our system to do that. We'll compare the results to the scope definition provided in the previous step. So we'll just follow the instructions that were created during the scoping of the data migration. And the testing process frequently will require a number of cycles of testing to finalize that the data migration programs have been developed correctly. It will ultimately include the customer in that process as well as needed for any clarification. So this step is completed by the Patagonia Health technical team with occasionally some input from the customer. Then the step 4, validation and sign-off. So finally, we execute the final migration process to the live database and actually for larger, more detailed conversions, we'll build it out for customers to click through within the application. And this too may require several cycles to finalize, as there may be some corrections to make to either the programs or ultimately the source of the data provided. That's not unusual for detailed level conversions. So ultimately, the data validation is the process of reviewing the data within the system to make sure that it's correct and complete. The customer is responsible for reviewing migrated data content, validating it, and then signing off. And then the final step is to migrate the conversion data to the live Patagonia Health database for our customer. So this will take place on a schedule as part of the implementation plan, and Patagonia Health will execute final data migration processes per that timeline. So if all of the previous steps are completed correctly, this final step is typically an uneventful one, as it should be. So the completed project steps would be then, we would have identified available data, determined which data to migrate and how with a strategy. Patagonia Health developed the conversion programs to the specifications. Data was reviewed and validated, and then data migrated completely and on schedule. And those are our 5 steps. So let's look at a few data migration assumptions, or sometimes expectations that come out that we hear. One assumption is any and all data is able to be migrated from a current system to a new system. Of course, that's false, because we don't know the quality of the data, we don't understand the integrity of the data, or the completeness of the data. And so it's not always possible to migrate certain data, but the better the customer has access to structured data within their existing system, the more likely that the data available to migrate can be detailed and comprehensive. And so, as such, limited access to structured data from an existing system will result in limited ability to migrate data in a detailed or comprehensive level. So, as per the data discovery process that we reviewed in step 1, the customer is responsible for extracting data from their current system and providing it to Patagonia Health. It will help with that process and those formats. Data items that are available to be migrated as part of a Patagonia Health system implementation and as defined or purchased or included on a sales contract include some of these standard items. Like demographics is a pretty straightforward process. And within the demographics, there's some required elements that we absolutely have to have. So the MRN number is preferred, and I'll talk about that here in a second. The patient's first name, patient's last name, the date of birth, and the gender are required to create a patient record. We look at additional demographic information that can be included. I list the MRN number again because the MRN is an option. We could actually bring in the medical record number from your current system, and that's preferred, or we can bring it in without a medical record number and add them automatically as you pull up patients for registration. The reason bringing in the medical record number from your current system is preferred is because it may be associated with other external registries or reporting repositories that will have that original MRN, and that's best for continuity purposes. So we always try to pull that in when we can. We also include, or have the ability to include, at your discretion, a variety of additional items like the paper chart number if you're using a physical chart within the office for easy reference, or start or intake date that you have from an existing system, social security number, race and ethnicity, marital status, preferred language. If you have more than one practice location, you can indicate which location is this patient's primary office. We keep Medicaid ID in our patient registration file for convenience, as Medicaid recipients can frequently go on and off of coverage, and it's good to have an anchor for that information. It's entirely up to you to migrate that if you'd like. We keep the full mailing address with 2 street addresses, county, state, and zip, plus the home phone, the work phone, mobile phone, and a couple of alternate phone numbers as well. We have a country of origin, a parent guardian information, and occasionally we can bring in a few more bits and pieces, but that's the core of the demographic record. And I've got an actual sample. Now I just cut and paste sort of one of the formatted sheets that we had built out that customers can use as a guide for migrating data. And so oftentimes when you look to the discovery process and look into your existing system, being able to run a report for something like demographics and then export it to an Excel sheet is the easiest way to begin that process. And so this is what we do, is we sort of create a formatted Excel sheet and then just say mimic this as best that you can. Things don't have to be in the same order, could be labeled a little bit differently, but typically if it can be put into a spreadsheet and it's within the elements that we would migrate normally, we're in good shape. We'll help you with the rest. Now there are some elements we don't migrate, some for real good reason. The data elements that are not migrated into Patagonia Health, some of them are because they're already included in the system or will be manually created during the implementation and training process. And those will include some things like patient insurance information. Patagonia Health, as a new product, comes built with over 2,500 insurance companies, and so that information is within the system already. And patient balance forwards, this can be done. It's a simple manual step for us. It provides flexibility for running out balances in our system. So sometimes the timing is not good. We've had folks that don't want to migrate balances at the time that they migrate maybe demographic data, because they may not want to run those statements until a few weeks before their first statement run. So the process in our system has been built to be very easy to add patient balances just before the first statement run, and most customers do it that way. And then scheduled appointments as well. We don't migrate those oftentimes because there are so many details and a volume of those that it's a good practice for the scheduling folks. The calendar in Patagonia Health is very flexible. It can be set up and configured in many ways, and so we just support the migration of appointments through a manual process. Additional data. Now there's some items that can be considered as sort of primary data elements for what we might call a custom data migration. These include clinical types and some associated clinical elements. All of these would be more easily migrated using the MRN number from your existing system as a key value. And so that's another reason to harvest that MRN number from your current system, because you can associate any additional elements to that number. Some of these elements are things like patient allergies, where we would pull and be able to migrate allergy types, severity, maybe a SNOMED code, something along those lines. Patient medications, we can bring in a medication name, a medication code like an NDC or an RX norm, a start date or discontinue date, a SIG, and maybe also the prescribed by person. Keep in mind that medications, really now can be synced with SureScripts once you're live. We have a lot of clients that do that. So typically we're not needing to migrate this way some of the patient medication information, so we're not doing this much anymore, but it is possible if needed. Patient problems and diagnoses, ICD-9s or ICD-10s, and the ICD description or a problem name or assessment description, all of that could be brought in. And then with patient immunizations, there's a lot of information here. So the vaccine name, the lot number, the lot expiration date, manufacturer, that all can come in, plus administration date, administration route, administration site, who administered the vaccine and who ordered the vaccine, the dose number, dose value, dose units, and then also like VFC eligibility and vaccine information, published dates and dates that presented to the patient, that kind of thing, plus some comments. There's some areas in there where we can bring in some free text. there's always a possibility to extend the data migration as well. So this additional custom data elements is that. We've done a few migrations where we had additional data, more comprehensive data, but this of course is based on a per request and a contracted service as well. So that's a motivating factor for you. Talk with your salesperson about that and we will accommodate you. We don't see much of this, but it is certainly something we've done and is very possible. So that concludes the presentation for today. Thanks for your time. At this point, we can take any questions that you have.
Right, so as I mentioned at the beginning, there's a questions box. If you want to go ahead and type in your questions there. Okay, so there's one question. We're a very small health department. How long does the whole process of conversion take? Don?
Oh, well, that's a hard question to answer. Typically, if you're a small health department and you want to migrate patient demographics only, we would just, it doesn't take much effort to pull that data out of your system usually. What I would do is at the initial meeting, our kickoff meeting, we would send along a series of documents that we use for our implementation kickoff. And one of those would be that spreadsheet that I showed you in the presentation as a guide for data extraction and have you, as a part of the initial process, go through the discovery step and run some reports out of your system and begin sending me sample data. And we would review it and go back and forth to get to a point where we're scoping that data through iterations of you pulling it. Sometimes it can be more than one report. But once we've achieved sort of a set of data that you're comfortable with, then we just set some dates to say when do we want to pull that final data, and it would be typically right around the training time. And so it might take a few report runs up front, a couple of weeks to maybe bounce back and forth with a couple of emails and discussions, and then we would set it on the implementation plan to do the final data pull and migration based on your training date. So pretty minimal effort for a demographic data migration.
Okay, another question. Can you explain the different types of data again, structured data and free text?
Okay, that's a good question. Structured data, again, there's two ways to look at information that comes out of a system. One is when you pick information off of a list. So like you do e-commerce and you click on the state that you live in. It usually is a pick list. And so all that's structured data. Races, if you go into a system, most systems will have a drop-down menu that the data can then be picked from, and it's a structured pick list. So that would be data that would be able to be mapped and structured data. Any data that's entered into a free text field that the user has full discretion over the input, then is not structured data. And so you can imagine, let's say that a client said, we have a comments field in our EHR on our, let's say on a demographic page, where we enter information about a guardian. Well, if the only thing they enter in there is a guardian name, and that's the only data, then it's essentially a structured data field. But if they enter alternate phone numbers, a guardian name, their pet's name, the 3 children's birth dates, we don't always know where to go get that unstructured data. So we'll help you make that determination. But typically data that's entered through a structured pick list or drop-down menu is ripe for migration, and that data is entered through a free text box is much more challenging and usually not a good candidate for data migration.
Okay, I have a couple more questions here, Don. We are considering switching from Insight. Have you experienced converting from Insight, and what are your learning from such conversion? How long does it take?
Wow, a lot of how long does it take question. Insight, yes, we've migrated numerous times from Insight and in various levels and had a great deal of success. How long it takes will depend on the amount, like I said in the presentation, the amount of data that you want to scope and have available, what your data migration strategy is, and our success rate with the data that's discovered in your system. But typically we are able to work within the overall implementation plan and have that data migration completed at the appropriate time, whether it's just prior to training or just prior to go live.
Okay, and the last question right now is, how have your other customers figured out how much data to migrate, and do you provide guidance with this?
Okay, yeah, that's the strategy question. So we had a client who was coming off a system that was on it for like 20 years and had over 1 million demographic records. Actually, it was kind of the example I used in the presentation. And so it came down to questions like, what will you use this data for? Like, do you need 22 years of demographic information? And so we'll help customers understand what the best way to scope the data is based on their purpose and their need. And so oftentimes it does come down to an active patient type flag. If they have the ability to use information from their current system, even though it's information that won't be migrated, like last visit date, that date could be used as a qualifier for what data to bring forward. So within that pool of 1 million patient records, we could look at a last visit date, and then the customer could decide that they're comfortable with 2 years or 3 years and only bring the demographic records over for patients that have been seen in their clinic or their health department within the last 2 or 3 years based on what their strategy is. So we'll coach folks through that. Ultimately, those decisions are the customers to make, but knowing that they have that option certainly helps them in making those decisions.
Okay, Don, I've got a couple questions from the same attendee, so I'll read them together. How much history in years is usually migrated? And if data isn't converted, what do clients typically do with the old data?
So how much data history in years is usually migrated? That, I kind of just answered that question a little bit. Sometimes it depends on, my question would be, what's your plan for that data? If you had that data migrated, who uses it? What do they use it for? And how far back would they look? And if it is not data that is going to be actively used, then you might think about a strategy that says it could be archived one way or another, which kind of leads to the next question is, if data isn't converted, even if you convert data, what happens to the data that's not converted? Some customers have access to the systems that they're on for periods of time afterwards. Some clients are on state-grown systems and they can log in and get that information for a period of time. It just depends on the situation. What do clients typically do with the old data? They can archive it in one fashion or another, and that could be with the existence of the current system, or oftentimes it can be purged or pushed out in like a PDF format and stored that way on a network drive or in a document storage capability. Now, Patagonia Health has a document management component within the product. So sometimes data that is not able to be migrated through the system, through a directly into Patagonia Health, into a discrete data point, could be put to pushed to a PDF and migrated as a document. And we've done that before as well. And so then the customer has control over that content, and then it comes down to a strategy definition. If I wanted to create a PDF for a historical record for my patients, tell us what you want on it, what the format is, and we can work with you to create that PDF document or even an encounter note that could be uploaded into Patagonia Health. Those are great questions. we have any others?
We have one. We are connected to Immunization Registry. Are there considerations related to immunization with conversion?
Yeah, I mentioned in the presentation that we've had clients who have been moving interface with an immunization registry within their state on their current system, and the identifier with that state immunization registry is their current MRN number. And so one point to make that I've made earlier was that bringing the MRN number over as part of the demographic conversion, then that becomes also the MRN number for the immunization interface we build for you to that same registry. And so those patients are identified in the registry exactly the same way, and that provides continuity for your state reporting.
I don't see any other unanswered questions yet, Don, but we'll hang on for just a few more minutes to see if anybody's typing them in. I know it takes a minute to type the lengthier questions sometimes.
Right. So while we're waiting for the questions, I would just say if data is a big concern, or data migration is a question that is important to you in making a decision about EHR move or whatnot, talk to us about that, and we can certainly help you understand what the capabilities are even further to your specific situation, and come up with a solution.
Okay.
Did we answer all the questions?
I think so. They're all looking good to me. So thank you very much for joining our webinar today. We're going to go ahead and close out. If you have further questions, you can always reach out to Patagonia Health, Don at patagoniahealth.com. He can maybe pick apart some additional questions if you have them in the future. Just got a non-question that says thanks. No acknowledged. We hope you enjoyed today's webinar. We will be publishing a new webinar series list for the upcoming months soon, and we hope you can join us again for future webinars. Thanks very much.